COVID-19 is making a comeback in the United States, and this time it's not just a small wave. We are facing a surge that could be more severe than anything we've seen before. The emergence of the new Omicron XEC variant poses a serious threat to public health, especially to older adults who remain the most vulnerable group. What's even more concerning are reports from health centers and disease control agencies showing that a significant number of these new cases are coming from immigrant communities originating from India and China, countries still battling intense COVID outbreaks. This raises pressing questions about whether border controls and quarantine measures for incoming travelers are being enforced strictly enough. More importantly, it makes us wonder if the government is withholding critical information about the spread to avoid public panic. Many Americans are left asking, is the government and health authorities being fully transparent about the current state of this pandemic? Signs suggest that the true extent and danger of this new variant may be underreported, which could lead to dangerous complacency across communities. In today's report, we will take a closer look at the Omicron XEC variant, how dangerous it really is, what symptoms to watch for, and most importantly, what steps you can take to protect yourself and your loved ones as COVID-19 surges once again. This is not just a virus story, it's a warning for all of us, especially seniors and their families. Listen carefully, understand the facts, and act before it's too late. Your health and the health of your family must be your top priority. The Omicron XCC variant. What you need to know, the Omicron XCC variant is the latest mutation of the SARS-CoV-2 virus, and early data suggest it could be more contagious and potentially more evasive than previous strains. Unlike earlier versions of the virus, Omicron XEC appears to spread faster, which means more people can get infected in a shorter period of time. This puts enormous pressure on hospitals and healthcare workers, especially in areas with low vaccination rates or vulnerable populations. Experts warn that this variant may partially bypass the protection offered by existing vaccines and prior infections. While vaccines remain the best defense, we have the ability of Omicron XEC to evade immune responses means that even vaccinated individuals, particularly older adults or those with weakened immune systems, are at increased risk of contracting the virus and experiencing severe symptoms. The rapid rise in cases linked to Omicron XEC is particularly troubling in several U.S. states where communities have large numbers of immigrants from India and China, countries currently facing significant outbreaks. This correlation raises serious questions about whether border screening and quarantine protocols are stringent and effective enough to prevent the virus from spreading unchecked. It also highlights a potential blind spot in public health policies that must be addressed immediately. Ignoring these warning signs is not an option. As this variant spreads, the risk to seniors increases dramatically. We cannot afford to wait for official numbers or reassurances. The time to act is now. Lessons from the past and present dangers. We cannot forget the dark days of the COVID-19 pandemic in 2020 and 2021 when hospitals were overwhelmed, thousands lost their lives daily, and society was paralyzed under strict lockdowns. Mismanagement, shortages of medical supplies, and failures in transparent communication forced America to pay a heavy price. As we moved into 2023 and 2024, it seemed the pandemic was under control thanks to vaccines and public health measures. But the reality tells a different story. New waves of COVID-19, especially the Omicron XEC variant, are creeping back with alarming speed and concerning immune evasion. This reminds us that the virus never truly vanished. It's quietly preparing for the next surge. Experts warn that government and community complacency, easing preventive measures too soon, has given the virus an opening to strike again. Lack of transparency in reporting and inconsistent messaging have sowed confusion and distrust, leading many to let down their guard. Looking back, previous waves taught us that delayed action, misinformation, and inconsistent policies accelerated transmission, causing devastating loss of life and economic damage. If we fail to learn from these lessons, we risk repeating mistakes, perhaps with even graver consequences. Therefore, 2023 and 2024 are not times to relax, but to reinforce defenses. Everyone, especially seniors and those with underlying conditions, must equip themselves with knowledge, take proactive precautions, and strictly follow health guidelines. We cannot rely solely on governments or health agencies. Individual action is the key to saving lives during this critical period. Don't let history repeat itself with unnecessary suffering. Stay alert, stay vigilant, and act now to protect yourself and those you love. Symptoms of the Omicron XE variant. What you can't afford to ignore. The Omicron XC variant isn't just spreading faster, it's showing more complex and varied symptoms than previous strains. Those infected often experience persistent cough, unexplained fatigue, loss of taste and smell, severe headaches, and even digestive issues like nausea and diarrhea. What's alarming is that these symptoms can easily be mistaken for common flu or mild illnesses. This leads many to underestimate the severity, delaying testing and treatment. As a result, the virus spreads silently in communities, especially among seniors, those with weaker immune systems who are far more vulnerable to severe complications. In reality, many older patients are being hospitalized with serious respiratory failure, requiring ventilators or intensive care due to late detection. This is a stark warning. Without vigilance, Omicron XEC could trigger a new wave of fatalities with devastating social and economic impacts. That's why early recognition and swift response to these symptoms aren't just critical, they can save your life and help protect your family and community. How to protect yourself against the Omicron XE variant. No room for complacency, as the Omicron XE variant spreads rapidly. Taking proactive steps to protect yourself is absolutely critical, especially for seniors and those with weakened immune systems. Remember, even if you're vaccinated or have had COVID before, the risk remains high. First and foremost, wearing a mask properly when you're outside is the simplest yet most effective way to block respiratory droplets and airborne virus particles. Your mask must cover both your nose and mouth, completely be changed regularly, and avoid touching your face. Next, maintain a safe distance of at least 6 feet from others, especially in crowded places or enclosed spaces. This is key to shielding yourself from potential sources of infection. Regular hand washing with soap or using hand sanitizer can't be overlooked. The virus can cling to surfaces and transfer to your face through touch, increasing your risk of infection. Limit gatherings and avoid crowded events or poorly ventilated areas whenever possible. If you can, stay home and cut back on non-essential activities. Finally, if you notice any symptoms or suspect you've been exposed, get tested and isolate promptly. Early detection and containment are vital to protecting both yourself and your community from severe consequences. We cannot rely solely on government agencies to keep us safe. Each of us must take responsibility as the first line of defense for our own health and for those we love. Your health is in your hands. We are at a critical moment in the fight against COVID-19. The Omicron XEC variant is spreading faster and more stealthily than before. The government's silence and lack of transparency should not leave you powerless or uninformed. Your health and the health of those you love depends on what you do right now. First, stay informed. Don't rely solely on official statements. Seek out trusted sources, watch for updates from independent health experts, and be alert to local infection trends. Second, act decisively. Wear your mask properly at all times in public, maintain social distancing, and practice rigorous hand hygiene. Don't let fatigue or frustration with the pandemic dull your vigilance. Third, monitor your health closely. Know the symptoms. If you or a family member feels even slightly unwell, get tested immediately. Early detection saves lives. Fourth, protect the vulnerable. Seniors, people with chronic illnesses, and the immunocompromised need extra care. Make sure they follow safety protocols and limit their exposure to unnecessary risks. This pandemic isn't over. Omicron XEC is a wake-up call, a reminder that complacency can cost lives. But with knowledge, vigilance, and action, we can face this challenge together and protect our families and communities. Remember, your health is in your hands. Act now. Stay safe. Save lives. COVID-19 has never truly disappeared, and now the Omicron XEC variant is making a concerning comeback with even greater strength. Early signs show it spreads faster and has an increased ability to evade immunity. This is especially alarming for seniors and those with weakened immune systems who face a much higher risk. We're confronted with a harsh reality. Official information may not fully reflect the severity of this outbreak. A lack of transparency can lead to complacency and lowered vigilance, giving the virus more opportunities to spread and cause heartbreaking consequences. In this context, each of us must take personal responsibility for our own health and that of our communities. No one else can do this for you. Understanding the risks, recognizing symptoms, strictly following preventive measures, and acting quickly are the only ways to protect yourself and your loved ones. This is not just a warning, it's a powerful call to action. Stay alert, stay proactive. Never underestimate even the smallest sign of danger. Act today to safeguard your health and those you care about. The fight against COVID-19 isn't over, and you are the last line of defense. Are you ready to protect your health and your loved ones? What steps will you take right now to prepare for this new wave of infections? Share your thoughts in the comments below. If you found this video helpful, don't forget to like, subscribe, and hit the notification bell so you won't miss important updates on health and the pandemic. Thank you for standing with us.